1. Which assessment is most critical before administering anesthesia? A. Skin turgor. B. Allergy history. C. Height and weight. D. Bowel sounds. 2. Which preoperative intervention is appropriate for a patient with diabetes? A. Increase insulin dose. B. Discontinue oral hypoglycemics without a physician's order. C. Monitor blood glucose closely and clarify insulin orders. D. Ensure no fluids for 12 hours. 3. In the surgical checklist, verifying the patient's identity is best achieved by A. Asking the surgeon. B. Using patient's ID bracelet and verbal confirmation. C. Asking the family. D. Checking room number. 4. Which lab value requires immediate reporting before surgery? A. Hemoglobin 13.5 gdl. B. Potassium 6.2 milliequivalent L. C. Glucose 120 mg dl. D. BUN 18 mg dl. 5. Which is a priority nursing action when preparing a patient with a latex allergy for surgery? A. Provide non-sterile gloves. B. Notify your team and use latex-free supplies. C. Restrict food 6 hours prior. D. Obtain an EKG. 6. Which role does the circulating nurse perform? A. Handles sterile instruments. B. Documents intraoperative events and ensures patient safety. C. Administers anesthesia. D. Sutures the wound. 7. The primary purpose of surgical counts is to A. Document supplies used. B. Monitor inventory. C. Prevent retained surgical items. D. Track nurse productivity. 8. When should the surgical count be performed? A. Before incision only. B. After the incision only. C. Before incision, during closure, and at skin closure. D. When the scrub tech decides. 9. Which factor increases the risk for intraoperative hypothermia? A. Hypertension. B. Warming blankets. C. Large body surface exposure. D. Early ambulation. 10. Which of the following best describes the Trendelenburg position? A. Supine with legs elevated. B. Head down tilt with patient on their back. C. Lateral recumbent position. D. Seated upright at 90 degrees. 11. Sterile technique is broken if a scrubbed person, A. Keeps hands above the waist. B. Turns back on a sterile field. C. Faces the sterile field. D. Wears sterile gloves. 12. What is the appropriate action if a sterile item becomes damp during surgery? A. Dry it with sterile towel. B. Continue using it. C. Discard it immediately. D. Wrap it in a sterile drape. 13. Which of the following is considered a restricted zone in the OR? A. Locker rooms. B. Clean utility room. C. Operating room itself. D. Hospital cafeteria. 14. A nurse opening a sterile package should open the first flap in which direction? A. Toward themselves. B. To the right. C. Away from themselves. D. To the left. 15. Which factor most contributes to surgical site infection SSI? A. Patient's diet. B. Duration of surgery. C. Anesthetic technique. D. Patient's clothing. 16. What is the priority during a surgical fire? A. Call the fire department. B. Remove the patient from danger. C. Document the event. D. Evacuate the entire surgical suite. 17. Which tool is used to assess risk of pressure injuries in the OR? A. Glasgow Coma Scale. B. Braden Scale. C. Morse Fall Scale. D. Aldrete Score. 18. Timeout verification before incision ensures clean instruments. B. Proper surgical attire. C. Correct patient, procedure, and site. D. Anesthesia level. 19. Which is a common sign of malignant hyperthermia? A. Decreased end tidal CO2. B. Bradycardia. C. Muscle rigidity and rising temperature. D. Hypoglycemia. 20. Which medication is used in the treatment of malignant hyperthermia? A. Epinephrine. B. Atropine. C. Dantrolene. D. Lidocaine. 21. Which of the following is a priority assessment in PACU? A. Nausea. B. Bowel sounds. C. Airway patency. D. Voiding. 22. What Aldrete score typically indicates readiness for discharge from PACU? A. 3, B. 5. C. 7. D. 9 or 10. 23. A patient post-thyroidectomy begins showing signs of tetany. What is the nurse's priority action? A. Reposition the neck. B. Notify the surgeon and prepare calcium gluconate. C. Apply warm compress. D. Encourage deep breathing. 24. Which sign most likely indicates hemorrhage postoperatively? A. Hypertension. B. Rapid, weak pulse and decreasing BP. C. Warm skin. D. Productive cough. 25. Which complication is the patient at highest risk for immediately after spinal anesthesia? A. Hypertension. B. Hypotension. C. Hyperglycemia. D. Nausea. Perioperative nurse certification. The Perioperative Nurse Certification (PNC) test is a professional credentialing exam designed to validate the knowledge, skills, and competencies of registered nurses working in the surgical setting. Typically aligned with the CNOR Certified Nurse Operating Room designation, this exam assesses a nurse's ability to provide safe, effective care before, during, and after surgical procedures. The test covers a wide range of domains, including preoperative assessment, intraoperative practices, aseptic technique, patient safety, postoperative care, and legal and ethical responsibilities. Achieving PNC certification demonstrates a nurse's commitment to excellence in perioperative practice, enhances professional credibility, and supports ongoing career advancement within surgical and procedural care environments. Here are the top 5 beneficial uses of the sample exam. 1. Validates professional competence. The PNC exam confirms a nurse's expertise in perioperative practices, ensuring they meet nationally recognized standards for surgical patient care. 2. Enhances career advancement. Certification can lead to increased job opportunities, promotions, and higher salary potential by demonstrating advanced skills and commitment to excellence. 3. Improves patient safety and outcomes. Certified perioperative nurses are more proficient in managing surgical risks, infection control, and patient safety protocols, leading to better clinical outcomes. 4. Strengthens employer confidence. Hospitals and surgical centers value certified nurses for their reliability and evidence-based practice, which supports accreditation and quality care goals. 5. Encourages lifelong learning. Maintaining certification requires continuing education, keeping nurses updated on the latest advancements in surgical care and professional standards.